1891, if you look back at Nashua, then it was a mill town, and the community needed a place to bring injured people that were being injured in the factory. And so our beginnings were that of the Nashua Emergency Hospital in the basement of the police station.
So this whole hospital started with the emergency department back in the late 1800s, and then eventually there was felt to be a true need for a hospital to take care of sicker patients that they were seeing.
From the early beginnings in the basement of the police station to the first hospital being built in Nashua in the early 1900s, and then ever since we've always been expanding and changing to meet the community needs. In my 28 years, it has been constantly building, renovating to make sure that our facilities and our technology stays up to date.
I have seen the changes, the expansions, some of the renovations that have taken place. 10 Prospect Street used to be the nurses' dormitory for the nurses who were going to school, and now that is a physicians' practices. Our surgery center is there.
Actually, there's not much left of the hospital that I started working at 36 years ago. Saw the demolition of the original hospital and the building of the East Building, which is now a major part of this hospital.
The nursing school actually was initiated in 1899, very, very close to the time the hospital was initiated, and lasted for 62 years. Southern New Hampshire Medical Center was a pace setter, actually, in enhancing the professionalism of nursing. And one of the first organizations in the area to develop a shared governance model where nurses are involved in decision-making. Magnet really validates the excellent care that we achieve here.
I think most nurses that work in labor and delivery and with postpartum families really have this very enthusiastic attitude about wanting families to start out, as I said, in a really strong way. And so historically, that's been something we've worked for all along. We don't like to separate mothers and babies. We want to keep them together, and we do everything we can to make sure that happens.
Turns out she actually has a DVT, a pretty big DVT.
Okay. I see a level of collaboration between physicians, nurses, and allied health providers, and a level of mutual respect that's higher than any organization I've been in. And I think that's tied into the roots and the history of our organization. It's being largely nursing-led.
The auxiliary and the volunteers started in the early 1900s. I believe it was 1918, when there was a flu epidemic throughout the country and global. Just in Nashua, almost 4,000 or about 4,000 people were infected. And ever since, the volunteers have been an integral part of our organization. Today, there's over 300 volunteers and auxiliary members, and they donate approximately 50,000 hours to this organization. I sometimes refer to them as the heart and soul of Southern New Hampshire Medical Center.
Well, it started many years ago. I came in here for a small operation. They took care of me. I said once I retired, I would come back and work or volunteer here. That's how I got here. I've been here, like I said, 13 years.
This is probably one of the most important things we did as an organization, was moving from being solely a community hospital to an integrated system, becoming Southern New Hampshire Medical Center and a multi-specialty group practice, Foundation Medical Partners, working collaboratively to take care of the community and meet needs.
Foundation Medical Partners was established as a vehicle to attract great physicians and allied health professionals to the area in a time where there was a shortage. We started with maybe a few dozen physicians in the early 90s, and today Foundation Medical Partners has 311 physicians and allied health professionals. Those are individuals that have signed up for the mission of Southern New Hampshire Health System. And so Foundation Medical Partners serves the needs of the physicians, so that they can serve the patients. There's a trust at the core of the relationship Foundation Medical Partners has with Southern New Hampshire Medical Center that is key to the success of Southern New Hampshire Health.
If I had to design a place that I wanted to work at and the way I wanted it to be in terms of structural, provider to administrator, access to specialists and subspecialists that I want to be at, the patient mix and demographics of the area and the location, I couldn't pick a better. I couldn't have designed it better.
That huge boom.
Yes.
I like that I can be part of the care decisions that are made for my patients. I like that I have a lot of leeway in how I practice medicine. It's not a cookie cutter approach. There is some science behind it, but every person is different. We have to approach everyone differently.
Behavioral health is getting a lot of attention today as a recognized need, but we recognize it as a need for decades, since the inception of Foundation Medical Partners. The behavioral health component with the physical component is key in caring for the total patient. And the economics have made it very difficult to continue to provide behavioral health services, but we've never backed down.
Southern New Hampshire has worked hard knowing that there are some things that may not generate a dollar for what they're doing, but the gain in health for the community really does pay that benefit. Many of our ED providers are medical directors for a lot of local ambulance services as well. So there is a dedication there that is nice to see.
Southern New Hampshire Medical Center is considered to be at the forefront of emergency management in the state of New Hampshire. We're involved at many levels within the greater Nashua community. It includes Nashua Fire Rescue, Nashua Police, EMS, Public Health, and the Nashua Office of Emergency Management.
Well, the fact that we are a financially stable organization in an industry that certainly has had its challenges, yet we take care of every single patient that knocks on our door for care. That's something to be proud of. The clinical affiliation Southern New Hampshire Health has with Massachusetts General Hospital is an important part of our history. By collaborating with Massachusetts General Hospital, we've been able to expand the scope of care that we can deliver to the patients in the greater Nashua community.
The affiliation with Mass General has been tremendous for us, especially in the emergency department, knowing that we have a very high-quality hospital that is only 45 minutes down the road from us, and the ability to transfer critical patients and complicated patients has been very beneficial.
We started with nothing going on between our two institutions a little less than 10 years ago, and now there's a robust set of clinical programs that are jointly operated, programs in cancer, vascular, stroke, trauma, just to name a few, and we continue to try to identify more opportunities to work together to better serve the patients we're here to serve.
I catch myself reflecting on what it was like in the early times when I came to work. When it was just Nashua Memorial Hospital, our facilities were not great, and I look at them today and how wonderful our campus has developed over the last 25 years. And we acquired the West Campus, and how important the West Campus is. And we've grown the foundation, and it has more than 40 different sites. Immediate care, seeing more than 40,000 visits a year and growing. So when I look back, I am so proud of what we've done to better serve the community.
So the black is the fat and
It's both our facilities, our technology, and the wonderful people that provide all the care.
I think realizing that Southern New Hampshire has been here for 125 years is truly amazing, knowing that there's been so many rapid changes in healthcare and so many challenges that have gone on. The fact that we've been able to provide for the community, again, is something I think we should all be very proud of and want to continue that tradition that we have.
I am proud of our unwavering commitment to serving our mission, and our mission is to meet the healthcare needs of the community, and that's ingrained in everything that we do. We have very committed dedicated employees. We have a strong community board, and there's a lot of exciting change ahead. And I think we're gonna be very successful in the future.
When I think about the history of the organization, it certainly is about the patient.
Just take a quick listen.
We still have characteristics that date back to 1891. When I think of nursing, when I think about the physicians and all the staff members that make this work every day, those qualities and characteristics have never left this organization. I'm very proud of every employee and what they do every day here. We've made a big difference. We've made a huge difference here in Nashua, and I'm really proud of how we work together to improve the health services of Nashua.